Moving on to Daniel Sostaita from Iglesia sin Fronteras. And Daniel, welcome.
You're welcome. Well, on the beginning, my minister, I practice what Jesus say. Always Jesus got question. Many people say Jesus the answer, but I think that Jesus got question. Jesus telling to the blind side man, how he can do for you. And this is what we do when I start the church. What I can do for you. And this is a picture for the mobile clinic. If we can, every Friday, we attended many people to come to the mobile clinic. If you move to the next slide, we see that this is inside the clinic, COVID test. You can move to the next one. The mammogram program, we do in partnership, the two important hospitals, Wake Forest and Novant Health. We offer 2 times a year to a lot of women can have an insurance because got a not legal status, but come to the church to do the mammograms 2 times a year. We can move to the next one. And this is what we're doing. Every year we're doing a screen 3 times a year for whole community. This group right there on the side is a pre-diabetes group. We can move to the next one. And also we're doing this year COVID response, and we can move. And we're doing great partnership with Love Out, Faith Health Department, and we offer food whole season. They come and to people pick out the food with the food pantry. We can move to the next one. And this is tax 4. You see in all the partnership, Faith Health, Archer, Radio, Amor, Wake Forest, and we all the leaders, we come together and we offer in different neighborhoods food, masks, and give information, hand sanitizer, whole Winston-Salem. We cover whole Winston-Salem. You can move to the next. And also with a Faith Health support, we move in Radio Onda Amor, move to the next. See, every week we offer conversation, we offer research, we move to the next. And the last, what are we doing with partnership with a Winston-Salem Foundation, we find some slow money, not much, only for illegal people, undocumented people. We help it with food, we help it pay the rent, we help it to pay any bills. And this is what I used to say, what I can do for you. We have many testimony. We're doing always something our people like the ladies as a abused lady with recovery, we're doing therapy, like the young boys got the drugs and we recovery too. We're doing a lot for our community. A Hispanic community is for many people is not existed. A lot of people can have researches for federal researchers for the status legal. Is what we asking, what I can do for you. This is what Jesus do, what I can do for you.
What I can do for you. Thank you, Daniel. It may have seemed like we got a view of the important work you do from a sort of a galloping horse as we went from slide to slide, but I'd like to invite Gary, who knows Daniel's work, to see if he could maybe say a few words as we move on to the next person.
So I'd make a link between my comments about St. Paul and Daniel's work. What you're seeing in these slides is not Daniel. It's the work of a pastor who is releasing the power of the community and getting the knee off the neck of that community. And so one of the slides Daniel didn't show was the screenshot of 250 people who he pretty much organized to hold the school system accountable as we began to move into COVID and the radical disparity, just the stunning evidence of the unfair patterns. Well, the same guy who organized all this helping people also organized the community voice to hold the community politicians accountable for the way they were administering the public trust of the educational system. So that's actually the heart of why I really wanted Daniel here. It's the art of helping the community power to flow through the right channel at the right time. And sometimes it's getting the hospital to show up with a mobile clinic. And sometimes it's getting the school system to show up with hiring more bilingual people in the system. So but it's all an expression of agency, of power.
Thank you, Gary, for that. And again, thank you, Dan.